breast cancer is ravaging lots of women, and I even understand some men. If you have a loved one, a friend, someone that has been diagnosed or has been living with breast cancer, my heart goes out to you.
Breast cancer is the most frequently diagnosed cancer among women in the U.S. 1 in 8 women will be diagnosed in their lifetime, according to health experts. That's why this month is so valuable to raise awareness. Nicole Marone is the executive director of Susan G. Komen, a New England organization that addresses the critical needs for breast cancer patients. She says that this month is also a valuable time to raise money for cancer research. Marone adds that early detection is key, as the earlier it is found, there's a greater chance it can be treated before it spreads. There are warning signs to look out for, like hard knots, lumps, swelling, or darkening of the breasts, which could all be signs of cancer. Experts say listen to your body and get a mammogram if you're 40 years of age.
It isn't always the most pleasant experience. Some people are just nervous and think they're going to hear the worst news. And honestly, again, get those mammograms, because earlier detection saves lives. I can't say it enough.
There are various factors. Lifestyle and family history may play a huge role in your approach to cancer treatment. Here with me to discuss high-risk breast cancer management is Dr. Caitlin Kennard, breast surgical oncologist with Jefferson's Sidney Kimmel Comprehensive Cancer Center. Dr. Kennard, think like a higher risk for breast cancer?
That's a great question. There are a lot of factors, as you touched on, that elevate someone's lifetime risk of breast cancer. But one factor that really increases one's lifetime risk is having a first-degree relative with breast cancer. This means having a mom, daughter, sister with breast cancer. So if someone is determined to be high risk, it's really important to discuss that with your doctor. Appointment with a breast medical oncologist or surgical oncologist for a risk assessment. At that time, we go through all of your personal and family history to determine if you are at elevated risk of breast cancer.
If additional testing is recommended, what does that mean? What are kind of the next steps?
For someone who is determined to be high risk, the additional recommendation is to do annual screening mammograms, so that's MRI. Breast MRI is great. It's really sensitive. It picks breast cancers up at the very earliest time, but it's not very specific. So a lot of the things that we pick up may not be a breast cancer. Only 20% of what we see on breast MRI is actually a breast cancer. So that's why we reserve breast MRI for women who are at an elevated lifetime risk of breast cancer, because when breast MRI is used in the average risk population, we're not increasing the likelihood that we're going to detect a breast cancer.
Now, if someone has dense breasts, is there something that they should be doing differently?
Absolutely. So if someone has dense breasts, we recommend screening mammogram every year, really using ultrasound to look at both breasts and the entire breast every year. The thing about dense breasts is dense breasts aren't bad. It just means that it can be harder to see into the breast tissue. Trying to find a breast cancer in women with dense breasts is like finding a snowflake in a snowstorm. The snowflake is the breast cancer, and the snowstorm is their breast tissue. So for women with dense breasts, we need something else to look inside the breast, and the whole breast ultrasound is that tool that we can use to see it. About 50% of women have dense breasts, and the really great thing is that you are notified at the time of your screening mammogram if you have dense breasts. They're heterogeneously or extremely dense breasts, and the good thing is we know if you have dense breasts, there are things that we know that we can do to make sure that we're seeing the whole breast and sure to detect it at the earliest time. By detecting it at the earliest time, we have great resources, great treatment options, and really a really good prognosis for women.
For the viewers at
Eating Well has this blog post for us: the #1 habit to start to help reduce your risk of breast cancer, according to experts. Breast cancer impacts a staggering number of people, and engaging in regular physical activity is one of the most effective habits you can adopt to reduce your risk of breast cancer. That is good news. Other tips for lowering breast cancer risk: staying up to date with your appointments. If you're over 40 years of age, go for mammograms once a year. Consuming a balanced nutrition, limiting alcohol consumption, that is if you drink, maintaining a healthy body weight, avoiding smoking, and if you are a nursing mother, breastfeed your baby. The bottom line is engaging in a regular physical activity is one of the most effective habits for reducing the risk of breast cancer. That has summed it up. And for you to reduce your chances of being diagnosed of breast cancer, from what we saw today, the risks are age, your gender, your lifestyle habits, and so many other things. And for you, one thing you can do today to reduce your risk is to move more. Move, move, move. You don't have to run a marathon. All you need to do is, in between sitting at your desk and your computer, get up and stretch, move. After your meals, move. Find an opportunity to move every 1 hour. This way, your body doesn't become sedentary. And this is one major thing according to Eating Well blog post. One major thing that reduces the risk of breast cancer diagnosis. I hope you enjoyed this video. And if you have breast cancer or you know someone going through it, please leave in the comments of this video. If you have survived breast cancer, you are a survivor. I respect you and I doff my hat for you. You are a strong woman. And if you know anyone going through this journey, all you need to do is be a source of pillar, a source of encouragement, and a source of support for that woman or that man that has this diagnosis. And as we create more awareness, we get our children and our grandchildren to get to know what to do to avoid getting breast cancer diagnosis. I hope you enjoyed this video. Let me know. Stay healthy and keep yourself in high spirits. That's the only way you can remain a warrior and victorious. See you in the next video. My name is Ngo, and I am passionate about helping you look your very best, no matter your age. Make lifestyle choices. I help women and men make lifestyle changes by giving them their own fitness trainer and a nutritionist. This makes it easy for you to live within healthy boundaries. And if you're interested, leave a comment for me or send me a direct message and we'll take this conversation further. Best.